Hi, on today's videos we're going to be discussing a bit about glaucoma. Glaucoma is a condition that damages the optic nerve inside the eye and causes peripheral visual field loss. I'm Dr. Palermo. I'm one of the partners here at Greater Houston Eye Consultants, and I deal with glaucoma on a daily basis. More than half of my patients from day to day are glaucoma-related patients. The main concern with glaucoma is making sure that we maintain the vision that we have to start with and don't add any damage to the peripheral vision over a period of time. Glaucoma is essentially a disease of the optic nerve. When we look inside the eye, what we see here is that the light will focus through the eyeball to the area where we call the macula, but all of this information from inside the eye travels through the optic nerve to get to the back of our head. Our vision's actually taking place in the back of our brain. If this optic nerve is damaged from the pressure inside the eye, then that starts to limit the amount of information that can travel from the eye to the brain. The pressure inside the eye is necessary up to a point. The pressure is essentially caused by either too much production in the area between the iris and the lens behind the eye, or not enough outflow in the area between what we call the angle, the iris and the cornea of the eye. Either way, the pressure needs to be reduced to attempt to take away the possibility of further nerve damage. Primary open-angle glaucoma is what we see most commonly. It's probably about 80% of the cases. And this is where basically either too much production or not enough outflow is taking place. There are patients that can have chronic narrow-angle glaucoma, where we're actually getting the iris of the eye, instead of being flat up against the lens, to move forward closer to the cornea and creating a narrower passage for the fluid to exit the eye. That therefore backs up the fluid and elevates the pressure as well. Either way, the treatment is mostly the same. Sometimes with the narrow angle glaucoma, laser needs to be done to allow a separate passage of that fluid that's more direct into the area where the drainage takes place. Most at risk for glaucoma, the patients that come in that are over the age of 60, of African American or Latin American descent, positive family history of glaucoma, or elevated intraocular pressure. Everybody knows that pressure is what we treat for glaucoma, but pressure is really just a risk factor. We have patients with pressure starting in the 30s that don't have glaucoma, and we have patients that we see for the first time with a pressure of 12 that has end-stage glaucoma. So it's more of what the nerve is willing to tolerate than what the number itself is. The main point to this whole thing is to get early diagnosis and treatment so it doesn't limit the vision later on in life. You can go completely lights out blind from glaucoma, but most patients, after the pressure has been controlled, have minimal, if any, progression at all. A yearly eye exam is necessary, and if the pressure is elevated, it is paramount to treat it early and continue with treatment permanently. Thank you. Have a good day.